My name is Emily George. I am a clinical implementation specialist at Ariadne Labs. And in November of 2017, Dr. Rose Molina and myself, on behalf of Ariadne Labs, went to Hospital Español in Veracruz, Mexico. We were invited by Dr. Antonio Ramos de la Medina, the Chief Medical Officer there, to actually do an implementation training on the WHO Safe Childbirth Checklist. Dr. Antonio was wanting to actually implement the checklist as part of a larger quality improvement initiative across the state, and we provided a training to over 70 nurses and physicians in the area. While I was in Veracruz, I sat down with Dr. Antonio and asked him some questions about his larger vision and his hopes for implementing the Safe Childbirth Checklist in Veracruz. Dr. Antonio, can you tell us how you first heard about the Safe Childbirth Checklist and why you were interested in bringing it to Veracruz?
Well, after we implemented the Safe Surgery Checklist, I started doing some research at the Ariadne Labs website. And then one day I saw that you were working on a better birth checklist. And so I became interested, and it was a little bit more multifactorial. We had a maternal death, and then we started looking into options to improve our care. And so when I came up with this initiative that was being done with the World Health Organization and Ariadne Labs, it was really interesting for us to be part of it. Maternal mortality is a problem that it's not only particular to private or public institutions. We think that it's a worldwide problem. And so we decided to be part of the solution. Our nurses need to be empowered, and we think that part of the change needs to come from the people that are in the field working every day. So we think that nurses are a big part of the change, and that we need to convince them that this is a good practice and that they can speak up and let even physicians know when they're doing something that it's not according to the best practices. And then also work with other physicians, part of all the stakeholders that need to be involved in this. And also just not only the physicians and the medical team, we also need to work with the board of trustees, we need to work with the administrative people, so that we're all involved in patient safety. When you go into medicine, you're trying to heal people, you're trying to make a difference. And sometimes during your training you realize that that's going to be hard. But when you work on small things, on little details, and you change one or two things that can create an impact on someone's life, it's something that is very rewarding. So this part of my job as a leader, as the Chief Medical Officer of the institution, has allowed me to do that, to create small changes that might make a difference on the way that we take care of just a few patients.